Hey guys, Dr. Pelto here. I want to go over some of the common questions I got this week. So hold on, I'll show you some of them right now. So this is some of the questions I got this week. One was about a charcot patient that was kind of tracking his temperatures. This is a plantar plate patient and ingrown toenail issue, and COVID toes, which everyone is kind of interested to learn about. So let's get right into it. We're starting with COVID toes, which is the most appropriate right now. This is a patient that had some redness on the tips of the toes. You can see this redness, how it gets a little bit red here. And a lot of people are finding this, and this can be in people with charcot, with COVID toes. I'm going to be talking about charcot a little bit, with COVID toes or without. And we're not really sure what causes it. We're thinking that it's a reaction due to the virus in your body. There has been some confusion, people thinking it might be a cold injury, such as Pernio or Raynaud's or chilblains or something like that. But basically, you don't have to do anything to treat it. The main complaints I get are the discoloration and the itching that people find, because basically you're having an injury to the skin underneath that area, and it's just going to have to resolve over time. To make the diagnosis, I guess you could do a biopsy, but probably not necessary. I would just kind of wait it out and see if it gets better. You could get tested, but if you're not having any other symptoms, it's kind of a mild problem that can happen with COVID. Next, treating plantar plate tears. This was a patient that came in, had pain underneath the metatarsal head, the second metatarsal head here. And you can see this is a transverse view right here. And there's an injury, or there's some swelling, that's an infusion on the side of this. Is an ultrasound. This is what we do when people come in after they have not recovered with some of the traditional therapy, and we are going to treat this patient. So let's talk about it here. With treating it, I usually get an x-ray first. Not so much, you can't see plantar plate with that, but then I'll get an ultrasound. If that's unclear, I'll get an MRI. This patient's tried icing, anti-inflammatories. We strap the toe down. Basically, we pull it down with a piece of tape. You can rest it. Shockwave is very effective for plantar plate tears or partial tears, not complete tears, partial tears, as well, PRP and amnio and some of these other things. And then offloading the area. If that doesn't get better, sometimes we have to do a surgery, especially if there's a really bad hammer toe, we have to correct that. Tracking temperature in a charcot patient. So this was a patient of mine. I have them when they start getting charcot, one of these guns. Basically, it's a temperature probe, and you can shoot it at the right foot and shoot it at the left foot. And you can tell kind of the difference in the temperature. And so this patient, he tracked the right foot and the left foot, and the one that's warmer, you can see here, by about 6 degrees is the affected one, and the unaffected one. And the interesting thing is, I don't know if it doesn't help encourage healing, but I think anything that you're making yourself more aware of your condition and how you're doing is important when you have charcot, and tells them to stay off of it. We're going to be talking to this patient later in a different interview, but I want to go over, he has been in a crow boot initially. He's now in a patellar tendon bearing brace, which is a big brace. And then he's going to be hopefully in that for a while until the temperature goes down. Then, if possible, either just a regular AFO or a regular diabetic extra depth shoe. Charcot, what is it? Basically, it's a condition that happens mostly in my practice to diabetics, where the bones get very soft and they break, but people don't know about it. A couple of reasons could be from the trauma with neuropathy and not knowing because you don't have the feeling, or it could be from increased blood flow to the area. But it's something you don't want. This is just something that we're doing here with having tracked their temperature. Don't do this in everyone, but it's something kind of cool. Here's kind of how we treat it. Just some tips here. There are some other videos that'll go more into it. Patient came in, is this broken or not? And we wanted to look at this. Looking at this, you can't tell. But when you get the x-ray, you can tell. There is a break in the toe, and it will get better over time. Basically, if there is a break, you want to, I think this was the broken one right here. I just want to give it time to get better. It'll get better over time, 6 to 8 weeks, if there's not a lot of displacement or change in the position of the bone. And then finally, there was a question from one of the viewers. They asked, what happened here? Well, this is a really bad ingrown toenail. So this patient had a part of the nail removed right here, and then they came back and they had an infection. So when we talk about after you have an ingrown toenail, that it can get infected. This is an infection, okay? There's redness, there's pus coming out of it. What needed to happen, this patient had to have all of this tissue kind of removed, flushed out, and I marked this area with a marker and put them on antibiotics, and it did get better pretty quickly. But there was an infection after the original ingrown toenail, okay? Once again, if you want to ask your own question, you can go to drpelto.com and ask your question, and it'll kind of tell you, pick a date that you want it answered, and we'll do a video on it. So hope you guys enjoyed this. Have a great day.